Welcome back. Tonight in Health Watch, we take a closer look at Wisconsin's recently adopted concussion bill.
It does not allow high school athletes to return to their sport after a concussion without written clearance by a health care provider. Wendy Cushel caught up with a local athletic trainer and athlete to learn more.
Licensed athletic trainer John Jandren works for Aurora BayCare Medical Center and does outreach at De Pere High School. He fully supports the new legislation.
Because the way I view it, especially being at a high school, is they're students first, athletes second. So not only is it affecting them with sports, it could affect them how they are academically. When
checking athletes, Aurora BayCare athletic trainers are very thorough.
There's about a series of 22 symptoms we check. We have a checklist we use that's developed by world-renowned doctors. It's called the Sideline Concussion Assessment Tool.
They've also started using an impact test. It includes a baseline test athletes take before a concussion were to occur, so athletic trainers can get a reading on where they're at before and after a hard hit that possibly caused a concussion.
Measures reactives, how quickly they can react, how quickly they react when they see things, and it's a very interesting test. It's very complex, and we have providers here that help read the test, help me make return to play guidelines in regards to that when they're ready to start their exertional type testing to get back out into the field.
They also do a balance error test.
With a kid, especially up to the age of 21, their brain is still growing, it's still developing. If they get hit again very frequently before they've recovered from a concussion, there's what's called second impact syndrome, which can be fatal if not caught.
17-year-old Naomi Henkelmann played volleyball at De Pere. John has treated her for 3 concussions.
Dizziness, headaches, emotional, I've noticed, and sensitivity to light. You never know, I didn't think I had a concussion, and then I finally saw the trainer, and I did.
Thanks, Wendy. Under the bill, there's a specific protocol athletes with a concussion must follow. First, they can't show any symptoms in order to move on to the next stage. They must then rest, have light exertion, slightly more strenuous exercise, onto non-contact drills. They then can resume full practice and return to play. And if you are worried your teen may have suffered a concussion or to get a baseline test done, you can call Aurora BayCare or email them at healthwatch@aurorabaycare.com.